Today we will look at the muscular system through chapter 11. So we are going to talk about how muscles can move the body. Here we see that skeletal muscles produce the movement by exerting force on tendons. The tendons are what actually attach to the bones, and this is how movement is produced. We will see an origin and insertion of the muscle. So most muscles will cross at least one joint. We see quite a few that cross two. So they will produce 2 to 3 to possibly even 4 ranges of motion or actions. When a muscle contracts, it will draw one bone closer to another at the articulating joint. So the origin of a muscle will be the attachment to a stationary bone, and then the insertion is attachment to a movable bone. So the insertion will move closer to the origin when a muscle contracts. So take the bicep for example. The insertion is going to be on the radius. The origin will be on the scapula. So when the bicep contracts, the radius or forearm will move closer to the shoulder. These joints work as levers. So bones are going to be the levers. The joints are the fulcrum, or the center movement. We're going to act on it by resistance and effort. So resistance will be the load, effort will be the contraction of the muscle. You can see here we have 3 different classes of lever, but the second class lever is where we will see the most force produced. This is why an example is a wheelbarrow. A small child can load quite a bit of weight into a wheelbarrow and still be able to move it. The other two, the first and third class levers, force is limited. Muscles are arranged in certain orders, with the muscle fibers being arranged within the fascicles. This is going to be how we produce a certain amount of power through a muscle, or the type of range of motion we can see, and we'll look at that. So we have a few different types of arrangements of these fascicles. So parallel, they're going to run from one tendon to the other. Fusiform, about the same, but we have quite a few more muscle fibers found within there, so it actually creates a little bit of a bulge, so it's a larger diameter. And then circular, it's exactly what it sounds like. So you can think of around the eye, we'll see the orbicularis oculi muscle. The triangular, so think of the pectoralis major. All these fascicles are spread out in a broad pattern and condense into one tendon there. Pinnate, we have uni, bi, and multi-pinnate. This is going to be the fascicles arranged on one side of the tendon on unipinnate, bipinnate, both sides of the tendon, and then multi-pinnate. We have multiple tendons with multiple arrangements of the fascicles. Okay, coordination of muscles. So to actually move our body, we have to be able to shut some muscles down while contracting others. So we can work in agonist-antagonist pairs. We'll see quite a few of those throughout. Agonist would be considered the prime mover. Then we'll see a synergist every now and then helping the agonist muscle along with that movement. So an example, we'll give an example real quick. So biceps and triceps. If you're wanting to flex the forearm, the agonist would be the biceps brachii. The antagonist would be the triceps. And then a synergist for the biceps would be the brachialis muscle. Okay, muscles can be named for many different reasons: location, size, direction of fibers, the action of the muscle. Here's a large table explaining how we can name all of those. So maximus, largest. We got minor is smaller, deltoid, triangular. And then we'll see some of these throughout. And then, of course, the action. So flexor, if a muscle has flexor in it, it decreases the joint angle. The opposite would be extensor. It increases the joint angle. Here is a look at superficial anterior muscles. We'll be naming a few to take a look at. The posterior side of the body, there's quite a few as well. So these next 3 slides are muscles that we will be picking out in particular to take a look at. So orbicularis oculi, it closes the eye. Pretty straightforward. So what you're wanting to look through with this group of muscles is going to be the location. So you'll have to find it on the body, which they are labeled here. So orbicularis oculi. And you'll want to know their actions. So platysma, drawing the outer part of the lip inferiorly and posteriorly. This is going to be this large flat muscle below the jaw. Masseter elevates the mandible. This helps us chew. Sternocleidomastoid, we have a few different actions. We can work with both of these muscles, left and right, contracting at the same time. So bilateral contraction flexes the cervical spine and extends the head at the atlanto-occipital joint. Unilateral, we will laterally flex, and then we will rotate the head. Trapezius, levator scapulae, rhomboids major and minor. These are all muscles you'll want to take a look at. Okay. Here we will see a few groups of muscles. So this group of muscles here, supraspinatus, infraspinatus, subscapularis, and teres minor, they all originate from the scapula and attach to the humerus. So these are known as the rotator cuff muscles. Do know their individual actions as well as their group name. Biceps brachii, very common muscle to know. Brachioradialis. Erector spinae. This is a group of muscles, iliocostalis, longissimus, and spinalis. They are known as the erector spinae on the posterior side of the body along the spine. They are to keep the spine erect. So it's right in the name, which is pretty fantastic. Rectus abdominis. Sounds like a dinosaur. This is going to flex the vertebral column, especially at the lumbar. So this is where the muscle you are looking at if you have a 6-pack of abs. Okay, psoas major is going to be your main hip flexor. Okay, and at the same time, we are rotating the thigh laterally. Now, an antagonist would be the gluteus maximus. We are extending the thigh at the hip. Quadriceps femoris, we're going to see 4 individual muscles making up this group. So quadriceps, quad is 4, ceps is head at the femur, so 4-headed muscle at the femur. This means we have rectus femoris, vastus lateralis, medialis, and intermedius. We are extending the leg at the knee. An antagonist would be a group of muscles known as the hamstrings. There are 3 seen here on the posterior side of the femur. We have biceps femoris, semitendinosus, and semimembranosus. We are flexing the leg at the knee, at the same time extending the thigh at the hip. And then we have 2 more, tibialis anterior, found at the anterior of the tibia. We're dorsiflexing the foot. And gastrocnemius, we are plantar flexing the foot. So these are also a pair of antagonist and agonist muscles. So as you can see through here, the muscles to know are labeled. So do know them and their location. You can see this is a group of rotator cuff muscles. Here are the erector spinae, the quadriceps, the hamstrings, and so on. So clinically, running injuries, it's good to stretch. You're actually stretching the tendon so the muscle can work at full capacity. Compartment syndrome, the pressure constricts the structures within a compartment, and this is damage to blood vessels, so it's very terrible to have. Plantar fasciitis, this is a very common condition to have among people. The plantar aponeurosis is going to be very constricted, and once you try to take a step, your foot will try and spread this aponeurosis and the muscles, and it feels as if it's tearing the structures on the sole of the foot. And that is it.